Hey, I'm excited to announce a new offering for Big Tree members, which is whole genome sequencing. So, this is a really exciting offering that's kind of the capstone of our Big Tree longevity program. If you want to do the most that you absolutely can for improving your lifespan, but also how healthy you are and kind of that last few decades of life, I think this is the best tool to have in your arsenal. In this video, I'm going to kind of go over what it is, how to use it, some examples, and just try to walk you through this really awesome tool. This is a big test. So this is, like, in my mind, superior to whole body MRIs or basically anything that you can possibly do. It complements the metabolic testing that we do through our longevity labs. But this is a cheek swab. Other companies that use this exact setup charge $10,000 per encounter. So for Big Tree members, our price is going to be $3,500 for the highest level testing. There's probably a phase 2 testing program that we will announce in a few months. But for the whole genome sequencing, which is the top end product that you can do anywhere, $3,500. And what do you get for that? That's a lot of money, right? Well, this was designed and implemented by a company called Biography Health. Their chief medical officer runs a company called Beverly Hills Precision Medicine, and this is basically his attempt to make a program that's applicable to a lot of people who are not, have $100 million plus net worths. You may know whole genome sequencing from the Human Genome Project, which was an endeavor 25, 30 years ago to actually map out every single base pair in the entire human genome. And what they did then, we can now do for an individual person, for you, with this testing protocol. So this looks at every single base pair in your exomes, which are the active parts of your DNA, and then provides us a series of reports that get integrated using artificial intelligence to create a roadmap for you to help you understand kind of what fight you're fighting. For example, if you use Peter Attia's paradigm of we're likely to die of one of 4 diseases, metabolic disease, heart disease, Alzheimer's, or cancer. Which of those fights are you fighting? Is there a specific cancer type that you are at high genetic risk for that you can kind of tilt your strategy into avoiding those causes of death, disability? And that's kind of what this is designed to do. So I thought the simplest thing to do is just kind of walk you through somebody's report. I'm not going to give any specific health information, of course, but I do think it'll give you a flavor for whether or not this would be appropriate for your quest to live as long as you can and live as healthy as you can towards the later part of your life. The first thing this provides is what's called polygenic risk scores. So again, this is looking just at your genetics. And then it says, okay, compared to the population, what percentile of your genetic risk are you for a variety of different diseases? So, for example, atrial fibrillation. Let's say you're in the 85th percentile for that risk. So that means just based on your genetics, not your lifestyle, but just your genetics, you are at higher risk than 85% of the population. Okay, that's high. Maybe not high enough to be actionable. Or your brain cancer risk. Let's say you're in the 99th percentile for your genetic risk for brain cancer. It might be worth getting periodic MRIs of your brain to try and catch this before it becomes a deal. And then our job is to help sit down with you and evaluate these risks and implement a strategy that helps you live as long as you can. So this looks at a variety of types of cancers: brain cancer, colorectal cancer, pancreatic cancer, prostate cancer, melanoma. It looks at a variety of autoimmune diseases like inflammatory bowel disease and psoriasis. It looks at a variety of metabolic conditions like hypertension, stroke, high triglycerides, type 2 diabetes. And then just gives you a percentile rank for those things. Now again, let's take pancreatic cancer. say like a third to a half of the total risk of that is your genes, right? But those are the things you can't change. So if you're at super high risk for pancreatic cancer from your genes, that is going to impact how you play your other risk factors, right? You may be a little more sensitive to other people about whether or not you should be drinking alcohol, for example, which is one of the risk factors for pancreatic cancer. So that's the potential game that you play. The way I think about this is it's helping me know the fight I'm fighting, right? So if my key risk is cardiovascular disease, awesome. Let's tilt a lot of things in that direction. Whereas if my key thing were Alzheimer's disease, then I'd be maybe more likely to be really interested in some early Alzheimer's treatments if my risk is super high for that. This also looks at what we call monogenic risks. So these are things like your ApoE gene, which if you have two ApoE4s, you're at about 10 times higher risk of Alzheimer's disease. This is your BRCA genes. This is your methylene tetrahydrofolate reductase, MTHFR genes. This is your also genes that impact the metabolism of drugs. So this is going to tell you, for example, oh, you can't take codeine because codeine is not metabolized by your body and it won't do anything. Or if you take certain antidepressants, your risk of getting too high blood levels is higher. And so this will walk you through all the drugs that are impacted by metabolism and tell you which drugs to steer away from, which drugs to start at lower doses, which drugs you're going to need higher doses for. So super helpful. So this is all your pharmacogenomic testing, if you know the buzzwords. This also looks at your carrier status. So do you carry a gene that's not impacting your health, but that if you had a child with someone who also carried that gene, then they would, if it's a recessive trait, have a 25% chance of having some very serious deadly disease. So, let's say you're a carrier of biotinidase deficiency, something you've probably never heard of. If you had a child with somebody else who had biotinidase deficiency as one of their genes, neither of you would be affected, but 1 in 4 of your offspring would be affected for a recessive trait. It also does tell your genetic ancestry, your 93% Central Western European or what have you, which is kind of fun. It also then goes into your nutritional recommendations and exercise recommendations. So it will walk through and say, okay, based on your genetics, from the best information we have, you're going to be somebody that responds particularly well to high intensity exercise versus low intensity exercise. You're going to be at a greater than likelihood of adding muscle strength with weightlifting. It says, this one that I'm looking at says that this person should do power training as opposed to endurance training. So it's kind of interesting. Then it also goes through nutritionally and looks at what nutrients you're going to be at highest or lowest risk of being deficient in or needing more or less of, right? So this person I'm glancing through, it will typically run slightly low calcium levels, and they need to work on their folic acid levels because of some of the genes that they carry. They're going to be not very sensitive to salt, which is good. They will tolerate higher salt in their diet, and the optimum diet type for them is a Mediterranean diet. Okay, so this looks at all your genes and these so-called single nucleotide polymorphisms to help you understand what to do with that. How do you digest all this information? Well, this is where AI is super helpful. So this AI has been trained in the Biography Health protocol to look at all this data and all of your health history. So this imports your health history. Any labs you have, for example, that you've done a big tree or other places can be dropped into the program. And then it creates you a series of custom recommendations, including like, hey, you should really get a coronary artery calcium score because your Lp(a) was high and your family your genetics suggested that you're going to be at higher risk of cardiovascular disease, right? Or recommending you check your folic acid levels or your homocysteine levels because of your MTHFR gene mutation that you carry. I'd also recommend medications and supplements based on your specific health risks, and also supplements to avoid, right? So you may need to avoid St. John's wort because of your hepatic enzymes that you carry genes for don't handle that very well. It also makes dietary recommendations and exercise recommendations and sleep recommendations, and then a series of prevention strategies that you can employ to help you live as long as you can and as healthy as you can. So we're super excited about this. So the Big Tree Longevity Protocol now is kind of a full package. We do a series of blood tests to look at your current metabolic health and help you understand what's going on. Obviously, that's impacted by your genetics, but it's also impacted by the choices that you make, right? We can also do physiologic testing like our VO2 max testing to help you get a understanding of how metabolically fit you are, which is one of the biggest indicators of lifespan is your VO2 max, which is basically how in shape you are. So we run you on a treadmill and attach a device, which I actually have here, to your face, which Bluetooths onto an iPad and measures how much respiratory gases you're taking in and putting out. And then the big piece is the Biography Health genomic sequencing, which gets this super detailed view of everything that's going on in your genes. Your genes aren't your whole story, right? They're kind of your backstory, but they're your backstory. And so I think it helps you understand if there's any really big things that are fights coming up on the horizon that you can prepare for. So we're excited about this. I think it has a role for some people who are interested in spending a lot of time and money to try and optimize where they're at. I don't think it's for everybody, but I think there are some people that are going to be really excited about this. You can message us on Spruce to have a conversation about whether or not this would be appropriate for you. We typically will mail you the test kit, the cheek swab that will walk you through, and then it takes about a month to get results back. Feel free to contact us with questions about this, but we're excited to roll this out for our patients.